Living with a chronic illness during the adolescent years can have a significant impact. In the early adolescent years, 12, 13, 14, it's around all the changes of body image and coming to terms with the physical changes of puberty.
When she hit puberty, she ended up with a bowel that started to stop just when it wanted to. So she felt very embarrassed walking around as a year 7 girl looking like she was 9 months pregnant and not being able to do the zipper up on a school skirt.
Adolescence has been a challenge. Scott would say more for me than for him. He's dealing with everything that goes with a spinal cord injury, as well as all the other normal adolescent things, as well as everything that was going on at school, being in high school.
During the middle years, the focus for growing up is around peer interaction and wanting to be part of the peer group, wanting to be normal. And having a chronic illness really makes you feel different, or can make you feel different. You're having to take medication, you're having to come to hospital visits, you're having to see doctors, you're having to spend time in hospital, when really you just want to be at school, you want to be with your friends, you want to be going out doing the normal things.
Living with a long-term chronic condition and being a teenager, sort of two opposites. Going out with friends is hard and a rare treat, but and some of my friends are okay with that, and others, sort of get annoyed.
They don't want to tell their friends. They don't want to show that, at a certain time they were both on growth hormones and they had to have this injection each night at a certain time. They didn't want to bring that out in front of everybody. If, we were at a dinner or people over, they didn't want to do it. They wanted to brush it under the carpet and wait till everybody left. And that just doesn't work like that.
She basically didn't do any school lessons between halfway through year 7 and the end of year 10. It's meant missing out on a lot of the normal socialising, whatever is normal, for teenagers, and a lot of the what people would see as regular independent steps through the teenage years.
You're trying to figure out who you are, what you want to do in life, and there's just always something there that's sort of pushing against you. Your friends quite don't understand it, and you disappear for days or weeks at a time just because you've been in hospital, and you come back to school and you just don't know what's happened for the last... A lot can happen in 2 weeks of a teenage life, I guess.
It's a big time for them to kind of have a lot of time off school and maybe not have those consistent friendships that other teenagers might.
She hasn't had the school friendships as tight, but she has had the hospital friends. And we foster and encourage those as much as we can. But we also have to be mindful of Rosie's own health, so we do things that are health appropriate. We'll talk about the medical side of things, because there's ileostomy, there's tube feeds, there's medications, there's facial paralysis, there's cutting up of food, different medical issues. So we talk about that at other times, so that it's not talked about as these are the hindrances from getting you out. No, yes, you can do this, you can do this, you go in and do this and enjoy it, but we talk about it at other times so that she's got in her armoury how she's going to handle her medical stuff when she is out. So when she is out, it's not an issue.
We would encourage parents to try to find a way for the young person to go to school camp, to find a way to do social activities, to find a way to manage to do as much of the normal activities as possible, so that they're able to achieve the goals of adolescence as well as manage their chronic illness optimally. If a young person starts to be really distressed with acting out behaviours, with social withdrawal, social isolation, missing school, these are all red flags to parents to say there's something more seriously wrong and that we need to get some help.
We found counselling was invaluable. Scott got counselling himself as a teenager, which was something he'd never had when he was younger, and we never really thought that he needed. It was something he didn't want and didn't need earlier on, although it was offered. As a teenager, he got to the point where he needed it.
Well, there are actually many services available for adolescents and for families to get help. There are the specialist adolescent services, but there are also community and adolescent mental health services, GPs who specialise in adolescents, psychologists who specialise in working with adolescents, and of course you want to put together a package of interventions that are going to actually target and support the young person and their family's needs.
A lot of patients, especially with chronic illnesses that have had a lot of hospitalisations, I think they sometimes over-identify with their illness. So it's important to really try and help them put it in perspective and help them to become independent and realise that there is a whole world out there that they can conquer. So being encouraging in that way and being that support network behind them is really important.
I'm her advocate because she has got medical issues. I'm still very much her parent, but as she's a teenager, we're becoming more friends. But I still hold the mum card, absolutely. The other good thing is that as she's getting older, we don't have to sort of simplify or maybe dumb down medical issues. We talk sort of almost adult to adult. There's no secrets, and she understands fully what is happening in each of her medical situations. And that's been really good because you can't put any wool over a teenager's eyes. There's no point trying to keep things secret and less than truthful.
As you can imagine, having a chronic illness as a teenager is a big impact on the teenager themselves, but it's also has a big impact on the family as a whole. So there's ferrying the patient to and from the hospital, there's encouraging them to take their medications or sometimes forcing them. So there are a lot of things to factor in for the whole family.
It's very hard, it affects everyone in the family. It affects, like most of the time, I'm in the hospital, like my other daughter, she felt like she's being left out.
You know, we had to learn what they could eat, what has potassium, what has too much sugar, what's, ratings of carbohydrates. We had to learn all that from scratch. And I was just living on edge, I guess, and forgot that I had the other three. Not forgot, but wasn't focusing much. It was just too much focus on them, and they didn't like it and made them more nervous.
A lot of the time the focus is on that child with a chronic illness, which makes things quite hard for siblings. So it's important to really keep it balanced in the family unit and know that there is support out there if you do need it.
I had the choice of whether I was going to clean my bathrooms or sit with my other kids and read them a story. Rosie took 10 hours a day to tube feed. My other kids needed me. I needed to spend quality time with them. So I got myself a cleaner. They just come in once a fortnight and they just do the floors and the bathrooms. And for that means that I might have to get my hair colour from Aldi for $7 instead of going to a hairdresser, or maybe I don't buy, we don't have takeout, but I know that even if we're in hospital, the bathrooms are going to be done and the house is going to be vacuumed. And so keeping short accounts with the house, I keep my sanity by keeping organised.
Being in a wheelchair, we have to plan every time we go out. how are we going to get there? How are we going to get him there? Are there steps? Because even if there's one step, we can't get him up. Is there a toilet that's accessible, that's big enough? Lots of planning. He tires easily. He can feel sick quite often, just at the drop of a hat, basically. That's something that tends to pass, tends to come and go fairly quickly, but when it happens, you just have to go with it.
We've ended up as a family having many international homestay students coming and living with us, and that has been twofold. It's been a financial input to the family, but it's also because as a family we haven't been able to travel anywhere, and so for the whole household it's meant bringing the world into the house, and teaching our kids about other cultures, other nations, but at the same time enriching the family so that then we're not rosy focused 24/7 but looking out.
Now we just take each day as it comes, and just focus on whatever happens and how to deal with it. We've gone back now and picked up where we left off with the other children, you know, in taking them back to the activities that I never had time for, and watching them excel in that sport or that area, and I'm just so happy that I did.
One of the things that we do is we always sit down for dinner at the table. That I covet that family time, and we discuss the day, and there's no television on, there's not even music on, and so there's that mutual time of just unpacking the day and hearing each other, and that's important.
I treated her like any other normal child. It's not about her being sick all the time. That's the best way.
I still have to do my chores, I still have to, you know, maintain a normal sort of lifestyle and that. So I believe the normality is something that's always kept me grounded, because you sort of need that in your life.
She'll have her shares of doing the dishes or cleaning or whatever is there. Like if we've got guests, she'll be there to entertain and everything.
Normality is something that I do treasure quite a lot, and it's something that I hold dearly, because at the end of the day you just need some normality in your life.
I also think it's really important for the parents to take care of themselves. A chronic illness doesn't only affect that patient, it affects the whole family, and we see that with a lot of our families. Like, they go through a lot of stressful times, and they kind of neglect themselves a little bit. So I think it's really important to kind of reach out and build their own support network as well.
My husband he was like working. He's a mechanic, diesel mechanic, and works in the truck. So he's always tired and he needs to come home. I try to not to get him too much involved with me, because he needs to concentrate on his work. She's fine, she's doing this, or you know, not too many details. You need someone who's just stay the way he is, so we can all have something different to talk about, I suppose. And he is supportive, always, like he says, have faith, she'll be fine.
In terms of coping myself over the years, yeah, it's very up and down. Scott keeps me going because he is a positive and happy person, so as long as he's doing well, we're all doing well as a family, basically. But I find talking to like-minded people, I do have another couple of women that I'm friends with who have kids with different things going on, and we met through school and we've become friends. So just going out for a coffee and we can talk to each other and understand what each other's saying, and I find that really good. But trying to take a bit of time out for yourself too, and it might just be going to have a cup of coffee or a browse around the shops, or just sit and read a book and have a cup of tea. You know, just stop yourself and stop your mind racing if you can, and yeah, take a little bit of time out. And I think counselling for yourself too, if you need it, it's very, very good, yeah, very helpful just to talk things through with someone from outside.
One of the biggest challenges growing up is trying to gain independence. You want to be able to drive, you want to be able to go where you need to go, and you just want to do your own thing. I guess when you have a medical condition, it's always a bit harder.
Independence might be, getting dressed yourself in the morning, or, eating your food without needing someone to tie it up for you. There's different levels of independence. A lot of people think independence is moving out of home or something, but even a little thing like cutting up food by yourself can be really encouraging to accomplish.
There is a big thing around letting go for parents. I think generally it's a hard thing. You see a child grow up and go through school and finish school and everything. So it's a big change for the patient and the parent. But I think when there's a chronic illness involved, it makes it extra hard because they've had to be there for everything, appointments and staying overnight at the hospital and giving medications and things like that. So it's a big thing for the parent to try and let go, and quite often it's a delayed letting go.
I am allowing Scott to be independent. He goes out by himself on public transport, and I have always asked him to ring me or text me when you get to wherever you're going. Now, he may only be going to a shopping centre, or he may be going to a peer support meeting that he goes to quite frequently. And I'd say, Scott, text me when you get there. Yes, Mum. And he was very good. He always did it. But I've even drawn back from that now because I've said to myself, I have an older son. He's 23. And I have to stop myself and think now, would I ask him to do the same thing? Do I expect him to ring me when he gets somewhere or to text me when he gets there? And the answer is no, of course you don't. So I've applied that principle to Scott too, and he's very happy about that.
Being independent, I think for any teenager, is a challenge for their parents, just because they're always used to giving you care and just being there to support you. But by being independent, it doesn't mean that you don't require their support or their care. You just want to, just take care of yourself and sort of give them a break as well.
I think it's good to start early and just take baby steps towards, transferring the taking of medications, that responsibility onto the teen.
He very much wants to go to his doctor's appointments himself without me now. And again, I think back to myself and I think, okay, he's 19. When I was 19, would I have wanted my mum doing these things with me? And the answer is no.
Gaining independence and being proactive in your care gives you a sense of, a little bit of sense of freedom, I guess. And it also enables you to be a bit more independent in other areas of your life because you realise that you can take care of yourself.
We did a bit of a trade-off and we had to discuss it, where he at times was getting annoyed with me for being too overbearing or too involved in things. So we did actually talk about it and said, well, okay, if you don't want me so much involved in talking to your doctors and that kind of thing, then you're really the one that has to instigate things. When you need things, instead of saying, well, Mum, can you ring up such and such, you have to do it. And he's taken it all on board.
A few times I've had to let them make their mistakes, and that's the only way that they get up now and they look for the things instead of me and tell me, instead of me looking for them and following them around. So the hardest part was just letting go.
Teens do need to take risks. It is a part of growing up. That's been harder, I think, in my case, because he's always had Mum hovering over him. So that's something that we're working on. But I think risks in our case may be different from what risks are for other people, in that for us a risk was letting him catch public transport by himself. That was huge. And that's really independence. That may have been as big a risk as you know, for some other kid getting their licence and going out on their own.
Lewis wanted to learn how to drive, and my husband said, no, we've got to let him, we can't just not. And I used to think, oh, what if, you know, he has a low and he's not aware and it's still too early and whatnot. And my husband said, no, he's got to learn. So we made a deal that my husband would take them and teach them how to drive.
They're big achievements too. When he achieves something like that by himself, something he hasn't done before, it's huge. It's huge for all of us, and it gives us all a lift. Basically, makes us all really happy that he's achieved another step. And it's hard to let go. It's very worthwhile.
I think it's really important for parents to seek out support groups for their adolescents, because it's great to have family support. It's very, very important. However, they still need someone that's their own age, that has actually gone through the things that they are going through, to be able to talk to them and have that extra support there that their school friends might not be able to give them.
Although teenagers have like the common ground of being in high school and having boyfriends or girlfriends, or, you know, going to parties, but people with chronic illnesses don't have that common ground. It's a struggle to get to school. It's, you don't have time for relationships, and you know, it's so finding someone that is in a similar position, you know, we can support and motivate each other to keep trying and persevering.
One of the brilliant things that she's discovered is Livewire, which is a chat room hosted by the Starlight Foundation. And there, because she doesn't necessarily get the same socialising with peers at school, these kids that she's socialising with on Livewire are all like hospital-minded.
Online communities for teenagers are really good because you don't have to talk like face to face. You can be typing, which is sort of a natural position. A natural thing for teenagers to do.
If you're looking for a support group in your area, it's a great point to start at is talking to your medical team at your treating hospital and talking to a social worker and seeing if they're aware of anything. If that fails, hop on the internet, type it into Google, and I'm sure there will be something come up. There's a lot more out there than you first think. So there are a lot of people going through the same issues that may be able to help you.
I was fortunate enough to be a part of a peer support group. It has been extremely helpful. It's a bunch of, you know, kids with a chronic illness. We all don't have the same illness, but it's pretty much the same. A cannula to one person is still a cannula to another person, or doctors and nurses, they all pretty much treat each patient the same despite their illness. And just knowing that you're not alone and you can get through it, and seeing other people's challenges and how they face them and how they deal with it, getting to probe what other people do is very helpful.
Scott's involved in the CHIPS peer support group, which is run down at the adolescent medicine group in the kids hospital, and it's chronic illness peer support. And he has a disability, but lots of the kids have all sorts of chronic illnesses, not necessarily disabilities. But it's just been a lifeline for it. He just loves it because all of the kids there, or the young adults, they just understand each other. And he says that they understand him more than perhaps I understand him as a parent, because they are all, even though they're all going through different things, they all have a lot in common. He has also learnt from that when he was having a lot of anxiety. He's learnt that that's very normal, and he's just like everybody else, and he knows that he can deal with it, and he knows that he will get through it. So he does social things with that group, but it's also a lot of support.
So we do stuff like getting out around the city. We go to the aquarium, we go to the IMAX theatre. We do a whole lot of things in and outside of the hospital. And then we have an end of year camp, which is 3 days of canoeing and rock climbing and everything, as well as team building activities. It really helps them to expand their support network throughout the program, and also to form very strong friendship bonds.
Transition is usually referred to as the planned, purposeful movement of young people with chronic medical conditions from child and family-centred care to an adult-centred care.
In Australia, we have two systems of health. We have a paediatric service and adult healthcare services.
There are cultural differences between the way a paediatric hospital works and the way an adult hospital works.
Kids' hospitals have multidisciplinary approach to healthcare. Usually there's a person like a pediatrician who's looking after the overall management of the care of the young person, and in the adult world there's no person who does the basic management. Usually the GP takes over that role, but nobody's looking at all the different areas at the one time. Each specific person looks at one particular area.
The GP is very important in the transition process because they will support the adult specialty teams.
The GP is the person who becomes the key player in your medical life. They're the ones who get every copy of, when you attend an appointment or a specialist appointment, they get copies of all that has happened. If you're admitted in hospital, they get copies of that as well.
We have a lovely GP. Rosie's been seeing him since she was born also. When she has her new specialists and transitions, those reports will then go to the GP and he will be her liaison person.
From the age of 16, 17, 18, that is what we call our active transition phase, when we're really actively preparing the young person and their family for where they will move on to.
Rosie's been coming to the Children's Hospital since she was 5 days old. She was transferred here, and now that she's 17 and a half, we're looking at transitioning her from the Children's Hospital to an adult hospital.
The doctors that have been looking after me it have been like talking to me a lot more, like over the past 2 to 3 years, and been it discussing things with me, and my mum has been present, but they've sort of done it gradually so that when I move it won't be a complete shock.
It's important that young people are aware that transition is coming and that they own it. You know, they need to be involved in the process so that they understand why it's happening and what needs to happen as well, so they can monitor it themselves.
When I began my transition, my specialist at the kids' hospital said, okay, next month you're no longer in our care, and this is who you need to go see at the adult hospital. They wrote me a letter and gave me the number, and I had to make a phone call saying, hi, my name's May Raffraff, and I'm going to be your new patient.
Obviously, the most important thing from a healthcare perspective is a comprehensive referral letter and investigation, so that transfer of health information is hugely important to the receiving team.
The role of the parent during transition is very important. I think they're the people who are there both sides, and as the kids have always had their parents with them, have leaned on them and have had that security.
Before the transition, like we've been with the same hospital for 15, 16 years, and it was a shock for me when we did the transition and went to the adult hospital when they say I can't be in the same room because she's an adult, and She can take care of herself.
Most parents find it very difficult to let go and let the young person start taking charge of their lives, but it's really important for them to start giving them the opportunity to do stuff gradually. You know, maybe in the last year start letting them do things so that if they're not there, the child is able to make decisions for themselves, the young person. It's important that they give a little bit of responsibility to the young person to be able to manage their own lives.
I think it's really important for parents to be positive about the move, not to undermine the move by being uncertain and by letting their adolescent pick up on that.
It's a natural progression for her to gain independence as a young adult, as a young person. And as much as we love having our children as children, we raise them to become young, independent, responsible adults, and this is part of that process. Some of the benefits of young people going to adult services is that they become more independent. They take over control of their own health and start managing their own health. It also gives them a sense of responsibility that it's their life and they can run their own lives and be able to make decisions as well about their own health care.
They treat you as an adult in the adult system, whereas at the kids' hospital, they tend to talk a lot to your parents, whereas when you get to the adult hospital, it's all about you. Being more responsible for yourself and being more proactive, it does make you feel good because you've accomplished something.
Transition to adult care is another graduation, and we celebrate it as a graduation. It's a time when they have achieved a lot within the paediatric healthcare setting, but it's time to move on. And we actually have an annual graduation event in this hospital where we provide certificates and T-shirt signing, and they get to say goodbye to their treating teams, and we wish them well for the future. And it's a great celebration of the time that they've had with us.
Families need to be able to plan the transition themselves, have a look at what they need to do to get the young person and themselves ready to go into the adult world. They also need to start preparing the young person to be able to manage their own care, to be able to sit in appointments and be able to talk and understand their own illnesses as well, so that they can talk about it intelligently.
We talk about a preparation phase, and that's really from perhaps the age of 12 years onwards, when we are really trying to encourage young people to take on some of their self-management.
I started to gain independence before I had transitioned, so I was about 15, 16. My condition requires me to have regular blood transfusions every 28 days. And I started by picking the day that I needed to have my transfusions. So that was one of the first decisions I made. And then my mother allowed me to make my doctor's appointments.
During the last 18 months, the doctors in adolescent medicine are much more tuned into talking directly to Rosie, getting Rosie to take responsibility for more of her care. I think it's going to be really important for Rosie particularly the initial stages of transferring to a hospitalist, an adult hospitalist, to go and visit it first. It is very important to take the young person for a pre-visit. We take them across and just let them have a look, ask questions, go to where they like going to where the food is, of course, show them where the canteen is, and where they come in when they come in, where they park, and where they will see the doctors, where they're likely to see the doctors. Also to the wards to see where they're likely to come and have a look and talk to the staff there, just to get a feel of what it is before they're actually sick and have to go in.
When I first went over there, I wrote a list of questions that I wanted answered. Just simple things. Where do I get my medicines from? Who's the doctor who's in charge of me? Where's the cafeteria? Where are the vending machines? Where's a good place to grab a coffee? Sort of, just things that you're going to have to know to make your life at an adult hospital or anywhere a bit more easier. Moving from the children's hospital to the adult hospital was a bit of a culture shock. In the adult system, it's very much about you're sick, you need to get better, and off you go. The paediatric system is lively, it's bubbly, it's friendly, it's approachable.
With young people and how they cope with transition, it's very individual. Some people like going to adult services. They actually like the thought of not having to sit around screaming kids, and they're quite happy to just come in and go, you know, without all the fuss of seeing 100 people. And some people don't. So some people like that atmosphere and that environment, and they want to keep that. So it's very individual for each person. Rosie herself has found it really difficult to be in wards where there's lots of little babies crying or lots of young siblings visiting. And I think one of the things that she'll really enjoy is moving on, gaining that independence that she needs.
I'm looking forward to be in a ward with people my age and older rather than screaming babies.
My first experience at the adult hospital was good. It was good. It was something new, it was something different. It symbolised the start of a new era in my life and in my treatment. Met a whole bunch of new people who were just as committed to my care as the kids' hospital was, and you know, just as professional, and they knew what they were doing.
When we did some research, we found that surprisingly, or perhaps not surprisingly, parents were the most anxious and worried about transition, and the young people, even though they had some uncertainties, were basically able to take it in their stride and felt pretty confident about navigating and moving on.
I guess with all changes, especially transition, that you do need time to adjust.
We're going to look at it as a fresh new challenge and as an exciting step